So you got young ones, you're wondering about dental health, wondering no more, help is on the way, and it's sitting right to my left because our guest here on a Friday to kick it off from Lynden Hills Dentistry is Dr. Nader Jahshan. Thanks for taking some time out of a busy practice to see us.
Hello, thank you for having me here.
How long have you been, well, first of all, over on your new location, how long have you been in operation there?
This is our third year in that location.
And you've been practicing for a little bit longer than that in a few other spots.
Yes, I'd say about in total 10 years.
Now, I found it really interesting when we first met and we were talking and got on the subject of the littlest ones, and we were talking about oral health. When am I supposed to start worrying about maybe getting a first dental checkup?
Well, you know, as soon as all the teeth start coming in, it's a good idea to get them started with having checks and exams and cleaning. So I'd say around the age of 1.5.
Is that for dental health, or is it also to demystify what you do? So Dr. Nader is a nice guy from the start.
I think it's a little bit of both. You know, we want children to be comfortable, and we want them to you know, have a positive experience, and so that should, you know, anything come up that needs to be done, you know, their first experience is not a bad one.
Now, you talk about a positive first experience, and everyone's gone through it. I went through it. I mean, when you get to what drills or any other thing going on, so when you're dealing with them that young, is it kind of a specialty to get them comfortable?
Well, yeah, absolutely. I mean, we do our best to make it a really fun experience, you know, the chair ride, and, you know, have a quick look, and you know, we just keep it really light, really fun, and maybe polish their teeth up, whatever they'll let us do that first appointment. And
your staff is such great, I'm going to call it an advertisement for any youngster coming in. If there's not a bad tooth in the place. It's perfect teeth all over the place. For parents, it'd be like, you know, look like Tia, the receptionist, you know. now, what happens at that first visit? Well,
that first visit, you know, it's really just an opportunity to introduce a child to the clinic and make them really comfortable, and more importantly, you know, it's an opportunity to speak with the parents and, you know, just learn more about the child's oral health and their diet, and, you know, guide them in the right direction.
The big question, and everyone's going to say, yeah, stupid question, but this is the one that's driven me crazy: a proper brushing technique. When you're trying to teach them at that age, what are we teaching them? Are we teaching them up and down? Are we teaching them what they do at the backs? And like, how do we teach them to brush properly?
How do we teach them? That's a very good question. And sometimes it is a challenge. But absolutely, you're right. You know, children always learn from example. So, you know, having the proper brushing technique, and really, you know, it's just, you know, it's a gentle circular motion, and just really spending the time. That's, I think, the most important thing with children. Sometimes they rush, you know, very quick in and out, and they're done, and sometimes that doesn't cut it.
Does it still work with "Happy Birthday to You"? Happy birthday to you.
Yeah, that's a good one. You know, sometimes just singing a song, or having maybe a, you know, just brushing to the tune of one song works.
Now, I'm kind of shocked at the fact that I've gotten into this before, flossing. At what age should they start flossing?
Well, you know, the sooner the better. Children develop their dexterity pretty fast, so I'd say by the age of 3 or 4, you know, just getting the hang of it, and really the best way to teach them is by example. You know, when they see parents flossing and brushing, and they want to do the same, hopefully.
You bring up a kind of a neat point, and when we talk about teaching kids the love of reading, we're supposed to read to them. So it sounds like one of the ideas you're thinking about, and, you know, just maybe the parent and the child brushing the teeth at the same time?
Exactly. You know, just making it a fun experience, that works really well. A lot of times children, you know, they like doing things themselves, but they do need a little bit of guidance. So, you know, showing them first, having them try it themselves, and then, you know, guiding them and finishing off where the areas they missed. So,
Dr. Nader, is it tough? I know with kids, okay, face gets dirty, we tell them scrub it, scrub it, scrub it, scrub it. That's the other thing with brushing. I hate to tell you how late in life I found out that you can brush too hard.
That's true. You can brush too hard, and so it's very important to use a very soft toothbrush and a mild toothpaste. Now, with little children, you want to use a toothpaste that's specifically for children that they can swallow. But frequency, I think, is the most important thing, as opposed to being very aggressive.
So flavors, electronic brushes, all this stuff, it still comes down to one thing: the longer you brush, the better?
Exactly, yes.
Okay, terrific. Again, if somebody wants to find some more information, we've had your website up there. They can check it out, and hopefully we can get you back here and kind of move things forward and talk about the whole process.
Absolutely.
Thanks for taking the time today.
Thank you very much, Ted.
Dr. Nader Jahshan's our guest from Lynden Hills Dentistry.